Wait for the mic if you don't mind.
Oh, my name is Denise Lazio. I reside in Lake Geneva, Wisconsin, not very far from here. I am a legal immigrant, and my pet peeve, I think...
You're legal, you said, right?
Legal!
Yeah, okay, I just want to make sure. You have an accent, okay? I just want to make sure what you said. I was going to say, there's a lot of law enforcement here, you know?
So my big pet peeve is illegal immigrants. One of them is pregnant woman crossing the border to give birth to an American, because anybody born in American soil becomes a citizen. There was talk of changing this, and I wondered if it has been pursued.
It has not. People call this anchor babies, which means someone can come here unlawfully, illegally, and then have a baby and it's born here and then it's an American citizen. I believe that is a constitutional provision, meaning there is a debate as to whether or not Congress can simply pass a law changing the definition of citizenship. Or is that in the Constitution, which it is, and you'd have to amend the Constitution to change the definition of citizenship. There's a big legal debate about that, and I think what many people believe is you have to actually literally change the definition of citizenship in the Constitution. I'm not so sure we want to go down that path. I understand the frustration, but I don't know if we want to open that can of worms up. Why don't we address the issue itself is the way I look at it. Let's just address the issue of illegal immigration in the first place. So we're dealing with a symptom of a problem without treating the problem. So let's deal with the problem. So I think there are about 5 or 6 things you need to do, and I won't bore you with all of it, that we're not doing to get a control on our border, to get our immigration system fixed. It's not working. But more importantly, the system of legal immigration has become extremely complicated and difficult as well. And so the harder you make it for a legal immigrant to get their visa, get a job, or to marry somebody, to use a visa, the more likely you'll have illegal immigration. So to me, you got to fix both the legal immigration system, which is convoluted and broken, and you got to fix first and foremost the problem of illegal immigration, which typically in this case is southern border crossings. That to me is just the source of the problem, and I want to fix that problem. Now, I think you have to go after identity theft, where people take other people's identities, social security numbers, and work illegally in society. You got to go after that. And I don't think we should do a national ID card. I actually think that that's a bad idea for civil libertarian reasons. Plus, I don't think these databases, when they're centralized, really work. I think there's a better way to do it, and I actually co-authored legislation with Gabby Giffords. You guys have all heard of Gabby by now. Co-authored legislation with Gabby, Sam Johnson, and others to get at identity theft and worker verification at the job, so that a person can't illegally take somebody's identity and then for work in this country. I think there's a better way to fix that. Then you got to beef up your border security. That's a longer conversation, but the point is, it's not working. There's a lot more that can be done to fix that. It is a federal responsibility. And then the third thing is, I think you need to have an immigration system that makes it easier if a job is not being taken by a citizen. And that's the key thing. If a job is not being taken by a citizen, nursery growers around here use guest workers. Somebody wants to come up temporarily and then come back. Have a system that works that way, so they don't have a incentive to take their whole family, but they can just come up for a season and go back. You have tamper-proof ID cards to allow them to do that. So you take pressure off of illegal border crossings so they can come through a regulated border. To me, the national security threat is the drug runners, some of the terrorists and criminals are trying to integrate themselves along with economic immigrants, and they're coming up into our country. If we can separate the economic immigrants from the people who mean us harm, who want to sell our kids drugs, I think that can go a long ways to helping us interdict the border. So I would rather do those things than try to go into rewriting the Constitution and its definition of citizenship, because I just think that's an effort that just it'll take years, and I just don't know if we want to go down that path. Let's start moving around. How about the guy in the back with the glasses who had his hand up? I'll just do 1 and 2 at a time. Is there a lady? How about the lady in the tan, I guess, that off yellow mustard color or whatever.
Good morning, Tony Police from Elkhorn. I guess my concern is I'm all in favor of repealing and replacing Obamacare, but with not enough votes in the Senate and the likelihood of not getting enough votes this next election cycle, I guess I'm wondering what can be done in terms of defunding the apparatus that would carry Obamacare out and killing it off that way rather than waiting for 60 votes in the Senate.
Well, first of all, the good news is you don't have to wait for 60 votes in the Senate. You ever heard of reconciliation? And people who watch this fight learn that part of Obamacare, the president's health care law, was passed through what we call reconciliation. Fiscal bills, budgets, those can't be filibustered. It's the one thing that cannot be filibustered is budgets or fiscal policy if it goes through the budget process. That only needs 51 votes. And much of this law, if not most of it, is a fiscal impact, has fiscal impacts. Taxes, fees, spending, things like that. And so you don't need 60 votes to deal with that. Point one is, that's point one. Point two, we've passed repealing it, we've passed defunding it, but if you don't have the Senate and the White House, that doesn't go anywhere, obviously. So you do have to have a change in leadership. You have to have a change in, I mean, this, you call it Obamacare. Obama's our president. I don't think he'll sign a law repealing the thing or even defunding the thing if he continues on as the president. If you don't have the Senate, you can't even pass it through the Senate. So, you know, elections do have consequences. And he and his party did have total control of the government in 2009 and 2010, so they were able to pass what they wanted to. That's where we are. Now, I think this law is a disaster. I don't think the healthcare system will survive this law. I think it will collapse under its own weight. But I would rather repeal it and replace it first than afterwards we have all this collateral damage of our healthcare system. I'll just give you one case in point. What a lot of folks don't know is this law rewrote Medicare also, and Medicaid. I mean, how many times have you come to town hall meetings where people were talking about stop raiding the Social Security Trust Fund and spending Social Security on other government programs? Well, this law starts that with Medicare. This law took $500 billion from Medicare to spend on the new Affordable Care Act for under 65-year-olds, for this new entitlement. And then what it did is it put this board called the IPAB, this Independent Payment Advisory Board of 15 people. The president appoints them starting in 2012, and it puts a total cap on all of Medicare spending, and then it lowers that cap. The estimates vary around about $500 billion. And the IPAB, this board of 15 people, it is their job to cut Medicare by lowering reimbursements to providers. And the problem with this, I have a lot of problems with this, it's designed to go around Congress. In the past, if you're going to change Medicare, Congress does it. Your elected representatives. Now, this law delegates to a group of unelected, unaccountable bureaucrats the sole power to put these things into being, into law. And if Congress doesn't like it, it has to have a supermajority vote to overturn it, and then it has to replace cuts in Medicare to some other cuts in Medicare somewhere else. So the whole intent of this is to have these unelected bureaucrats basically reducing reimbursements to providers to the point where the chief actuary at Medicare is now telling us by the end of the decade, Medicare will be reimbursing all your healthcare providers at rates lower than, Medicare will be reimbursing all of your healthcare providers at rates less than Medicaid. What that simply means is they're just going to stop offering Medicare. They're going to stop taking Medicare patients. So I really believe it's going to collapse the system. Not just the Medicare system, but I also think the way the law is designed is it basically encourages a business to dump their employees in the government exchange. As a business, you have to offer your employees, a business of 50 or more employees, you have to offer your employees the exact actual equivalent kind of insurance that the government plan has. And here's the problem. The government will under-reimburse providers. So that they're going to get about 60 cents on the dollar according to Medicare actuaries. So when they lose 40 cents on every dollar for everybody coming in healthcare that way, they overcharge the private payers. They overcharge private insurance and private companies offering health insurance to their employees, so their prices go up. So if you're an employer and your prices are going up and up and up, but they can get, your employees can get the same insurance over here with subsidies, you're going to dump them. And here's why. If you get it wrong as an employer, if you do anything wrong that doesn't meet the federal definition of the kind of insurance you must provide your employees, It's a $3,000 per employee fine every year. But, here's the catch. If you want to get rid of offering health insurance to your employees, put them in the government plan, it's $2,000 per employee, indexed at inflation. So what do you think businesses are going to do? I mean, the surveys we're seeing coming in, whether it's McKinsey or Lewin, are telling us that the majority of employers are looking at this situation and saying, there's no way I can afford to keep doing this. What if my competitor, puts his employees in the exchange and he goes from, $17,000 a year per employee to $2,000? I can't compete with that. So what we're worried about is if this law actually sticks and really kicks in 2014, you're going to just see an avalanche of people being dropped from their employer health insurance and put into the government health care plan, which will explode the costs. And so this is why I think it's going to collapse the system. And this is why, I really believe we need to repeal the law, start over. The system needed fixing before, no two ways about that. But I think there are just far better ideas that can get us to what we need to get to, which is affordable health care for everybody, including people with pre-existing conditions. I think you can get there without having this government system take it over. I'm sorry that took a little while, but it's a big question. How about the